Hi everybody, I'm Lisa Parker of the NBC Chicago News Team. AgeOptions started back in 1974 as an area agency on aging, founded to connect federal funding with community organizations. To keep pace with the rapid growth of the older adult population, AgeOptions relies on a unique combination of both government and private funding to do a number of things, including testing new service models, forming strong collaborative efforts, and perhaps most importantly, to provide reliable and unbiased answers on questions about both aging and disability issues. By caring in a new era, AgeOptions has become much more.
I first became familiar with AgeOptions when I worked in Congress. I was a staff member working in both the U.S. Senate and the House of Representatives. And why would I get to know this organization when I was working in Congress? I think it was because this organization was, in the very get-go, doing extraordinary work, exemplary work. AgeOptions differentiates itself from many other area agencies on aging, perhaps most other area agencies on aging, by the breadth of the services that they provide, by the different commitments that they've made to protecting the rights of older people and improving their lives. I think this is a highly entrepreneurial organization that has ventured into many different directions, all of them important to addressing the needs of an older adult population.
When speaking with my colleagues, I can speak with great pride about AgeOptions. It's an organization that has been delivering services from the very beginning of the Older Americans Act, but it's also an organization that is infused with innovation. It's trying to figure out new ways and creative ways to interact with our communities, trying to figure out thoughtful ways to interact with the healthcare team on a consistent basis to try and create better outcomes. And to be a part of that and be a part of those conversations is really fun.
I often get asked, because I happen to live in Washington, D.C., I get asked by people in our field, so what do you think, Bill, what's a good AAA? Give me an example of a good area agency on aging or a good provider of services to the elderly. And I inevitably include AgeOptions in my top tier list. Caring in a new era seems to me to be the perfect way to frame AgeOptions. We have a demographic revolution taking place with the numbers of older people, and not just the numbers of older people, but the numbers that are moving into very advanced old age, who are living far longer.
To me, caring in a new era means finding unique ways to service the diverse community, an ever-growing community. It has to do with the changing face of America. Although Latino community and different diverse communities have been in the United States, the increasing numbers and the diversity is pretty obvious, and it's happening in the aging services in numbers that we've never seen before.
Caring in a new era can mean a great deal of things. In the end, whether you're a physician like myself or you're an organization delivering meals to people's homes, it's about how you can support older adults in the communities that we serve. And Caring in a New Era is really reorganizing all the different parts and pieces of the puzzle that work on doing that shared objective. AgeOptions has created a set of programs that are also targeted at caregivers in our communities. As a physician in practice, it's an everyday experience for me to deal with caregivers who are supporting patients who I'm directly serving. And you can see the vital role that those caregivers play.
I learned about AgeOptions when I started working in Melrose Park. We opened the first welcoming center in Melrose Park, and that has been very rewarding. And it really opened my path to a new way of partnering. And I think AgeOptions has become the model that I would love for all the AAAs to become. We can only be as good as our partners. And if we didn't have AgeOptions, I couldn't have taken a senior out of an abusive relationship. I couldn't keep the senior safe.
We have a program called Money Follows the Person's Pathways to Community Living. It's an initiative program whereas we go into nursing facilities and we try to get individuals who possibly do not need long-term care, and we try to integrate them back into the community. Caring in a new era, to me, means giving back choices that were not originally available It's giving us more choices for older adults, persons with disabilities, giving them choices about where they can live. When I tell someone in a long-term care facility that they may be able to return to home-based services and community living, they are so excited. They're like, are you kidding me? You know, is this for real? And I tell them, yes, it's for real if you want it to be. Of course, you decide whether or not you transition. We assist individuals with fraud cases. We assist individuals with options counseling for older age, preparing them for the future. We give them their choices. We try to let them know that whatever you're going through, there's some service out there that can assist you with your situation. So at AgeOptions, it's always something different, something new, and something exciting.
Each era brings opportunities to care in new ways. Today, the aging population is growing rapidly. Older adults are living longer and they're seeking ongoing work and engagement inside their own communities. There are emerging opportunities to care for people with disabilities, and safety net programs have to continue in the face of uncertain federal and state funding. Technology is now opening up possibilities that couldn't even be dreamed of even 10 years ago. And seniors from all cultures and language groups need both services and support. So much is possible in this new environment, but AgeOptions needs your partnership to ensure the quality of life and the dignity for the aging population in this area. There's so many things that you can do. You can make a gift to AgeOptions, or you can volunteer with one of their many programs. Work with AgeOptions as they are now caring in a new era.